so hopefully he was going to come to some conclusions. But he thought that the chronic marijuana use and the amounts of marijuana that are smoked there, because some people just, they smoke it all day long, he felt that was contributing to a higher incidence of schizophrenia among the people in Jamaica. Now, there's definitely data to suggest that that may be what's happening, and again, I'll tell you that I have seen many cases where kids and young adults do become psychotic and have to be actually hospitalized in a psychiatric program because they kind of have lost touch with reality from their marijuana use. Now, I will say that in many of these cases, they probably had an underlying mental disorder. It's not uncommon for marijuana to bring that out in people, or certainly to exacerbate something that's already there. But we need to be aware that it does have that potential. Now, what are some of the physical effects? What does it do to your body? Well, it affects the respiratory system just like tobacco would, right? We all, I think, at this point understand that cigarettes are bad and that, you know, it affects your health and you can die from cigarette addiction and all of that, but marijuana does the same thing. In fact, you see things in chronic marijuana smokers, and I've seen this in kids, so you know, this does not have to be someone who's been smoking for 20 years. I've seen this in kids who have been smoking for a couple of years. Daily cough and phlegm production due to irritants caused by the marijuana, more frequent acute chest illnesses, heightened risk of lung infections, and a greater tendency towards having an obstructed airway disease. You also see cancer of the respiratory tract, an increased risk of cancer overall, in some cases double or triple. And marijuana contains 50 to 70% more carcinogens than tobacco does. Here's the thing that kids always think. They always say to me, oh no, cigarettes are much worse for you than smoking marijuana. No. If you're smoking marijuana on a regular basis, you have you're running the risk to have all these health consequences begin to happen to you. The immune system. Marijuana compromises the body's immune system. It absolutely makes you more susceptible to things like colds and bronchitis and other illnesses, infectious diseases, and then there's the heart, the effect on the heart that we've already talked about. Any questions so far? Okay. So let's talk about how marijuana affects a person's life. What does a chronic marijuana smoker look like? How do they behave? What do they do? Well, kids who smoke marijuana get lower grades. They're less likely to graduate from high school compared with their peers. They have higher dropout rates. They experience loss of motivation and interest in school, and interest in other activities like sports and hobbies and church and things that maybe at one time were appealing to them. They isolate from their family. They're more defiant. They stop maturing emotionally and intellectually. They don't develop critical life skills that they need to develop. We know that adolescence is a period of kind of going through these developmental tasks, becoming competent, learning to feel confident. They don't get that. They don't go through that process the way normal teenagers do. In fact, many kids who start smoking marijuana at 13 or 14 stop maturing, essentially. So we see kids in our program that are 17, 18, 19 years old that have been smoking for 3, 4, 5 years. Chronologically, they may be 18 or 19, but they're behaving, they're acting like they are 14 or 15 because they haven't progressed and matured and developed those life skills and those problem-solving skills and those emotional skills, because adolescence is such an emotional time, isn't it? There's so much confusion, there's so many changes happening, you know, hormonal, physical changes, all of that, that they use marijuana to cope. They begin to use marijuana to deal with their feelings and their emotions, rather than learning how to deal with those in more healthy, appropriate, and productive ways. And that's probably one of the things that I see the most in our program is these kids that come in, they may be a little older, they've been smoking marijuana a couple of years, and they just are so delayed emotionally. And even cognitively, I mean intellectually, they stop growing, they stop maturing. And it's actually a very common thing. It's sad to see a kid who's 20, 25 years old and who's been smoking for a number of years, and he walks around and his confidence so low, he has no self-esteem, he doesn't feel competent to be out in the world and making good decisions, and in many cases they feel like little kids in an adult body. And I hear them say that a lot. And the kids that end up recovering have a very rough time, because here they are trying to recover, trying to stop using the drug, trying to regain some kind of normal life, and they're so delayed that they have a lot of years to make up, and they get overwhelmed by that and they get discouraged by that. So it really is very harmful to them in that area. They become more impulsive. They have trouble with emotional regulation. I think I touched on that a little bit. Having the ability to kind of manage and regulate your emotions is something we all have to learn. We typically start to learn that in adolescence, and they don't do well with that. Have a lot of outbursts. They get angry very easily. They become defiant. They become irritable. They get frustrated. They act out. They don't seem to be able to manage their emotions in healthy and productive ways. There's also a higher incidence of juvenile crimes and delinquency among teenagers who smoke marijuana. We definitely see kids that will begin to engage in marijuana use or alcohol use. We talk about the gateway drugs. Sometimes you've probably heard that term. It doesn't mean that if you smoke marijuana, you're going to end up using harder drugs. But what it does mean is most people who use harder drugs started with the gateway drugs, and those would be marijuana, alcohol, cigarettes. Cigarettes are a really good indicator or predictor in teenagers of future drug use. Marijuana is as well. So if you look at, if you come to South Miami Hospital and you were to ask our adults, 40, 50-year-olds that are using all types of different drugs, if you were to ask them what drug did they start using, they didn't start with heroin or cocaine or OxyContin or any of that. They started with alcohol, marijuana, and cigarettes, and that opened the door and led them to be exposed to a lifestyle that also compromised their own internal values. They made a lot of justifications to smoke marijuana in the first place, so it's not a big jump once you do that to start trying other drugs, and before you know it, they've been introduced to things that are much more dangerous and much more addictive. Now, how does it affect adults? Well, at work we see an increased absenteeism. People miss a lot of work. They have a lot of tardiness. They are more prone to accidents on the job. They have higher job turnover. And they have more workers' compensation claims. So it affects adults as well. Someone who smokes marijuana regularly may be functioning at an overall reduced intellectual capacity, even when they're not high. And this is especially true for children. Let me tell you why that is, because people think that, well, I smoked marijuana yesterday, so today, I'm not high today, I haven't smoked marijuana today, so it's not affecting me now. And that is just not true. Marijuana is one of the drugs that actually lingers around in the body and in the brain for a long time. It is stored in fat, so it really hangs around for a long time. It's hard for your body to process it and clean it up. It stays in the body for a month or even 2 after you've stopped smoking it. And so its effects, they're cumulative in the sense that the marijuana that you smoked 2 days ago is still in your system when you smoke marijuana again today or tomorrow. And it kind of builds, it builds in your body. So even when you're not smoking marijuana, when you're not high, you're still being affected by it. And over time, these cumulative effects, I think, are responsible for people beginning to function at a lower level. you just see people that just are not functioning at their potential.